Do you ever get that sense of deja vu? This is Bifida blog. Welcome back to Bifida blog. It's early morning on Thursday and normal services resumed in terms of the cog keeps on going. I'm going to work, Heidi's off to nursery today. As far as I know, Noah's had a fairly good night. Hopefully we're going to get some results back from a CT scan that he had yesterday and some decision on exactly what they want to maybe operate in terms of what they're actually going to put in. So we'll see. I know Louise is going to be up there pretty much all day and just doing the normal stuff. So fairly normal day.
Day has been a bit mad, to say the least, especially this afternoon, or late morning this afternoon and evening in particular. So apologies for the lack of footage, but there hasn't really been time to do a great deal. Sort of like late this morning, early afternoon, Noah started to work really hard on his breathing. He was chugging in at his ribs, nostrils flaring, usual signs that we're all too familiar with Heidi. His stridor noise also was quite prominent all day, so it almost sounded like he was gasping at every breath, even when he was asleep and settled. So I mentioned this several times to the nurse, and she was like, "Oh, I don't think it's anything, I think he's okay, blah blah blah." So I kept mentioning it to her anyway, and eventually she got the doctor to come and have a look. And the doctor agreed that he was having to put a lot of effort and extra effort into his breathing. So she decided to take some blood gases to check his levels and whatnot. And she also tried to put a cannula in, again, like 5 attempts with no luck. And she ordered him a routine chest x-ray. Noah was moved into HDU at around 7 o'clock. And put onto high flow oxygen. He was on low flow before. After handover, when I went back, he'd been moved to intensive care again. Not the room we started in, room 2. But he was much more settled being on the high flow. I asked the doctor what the x-ray had shown and said a possible collapse. They'd also sent off bloods, like more detailed bloods, to see if there was any kind of infection, but we haven't had the results of that back as yet. So hopefully in the morning we'll know a bit more about what's going on. So yeah, a real intense afternoon for both Noah and me. The plastic surgeon came this afternoon and had a look at Noah's wound. He was really pleased with how it was healing. Still a bit oozy, but healing, right, as opposed to looking green and infected. He also said that Noah can start going on his back now, but because of the extra effort in his breathing, he actually can't go on his back at the moment. So hopefully once the breathing's under control, he'll be able to go in whatever position he likes, which is good news. ENT came down this morning and they're happy that they don't need to do anything for Noah at the moment. He'll just have a outpatient's appointment once we're discharged. Monkey's spending the night with me because they're not allowed stuffed toys in the intensive care rooms. So he's going to snuggle up with me tonight.
Okay, so it's late at night on Thursday and I've just really had the update from Louise. So several issues and trying to get hold of me, etc. But I don't think she's had much time to actually do much reporting to me anyway. But obviously the news isn't particularly great. Definitely not what we expected. And obviously a great sense of deja vu. We've been here before with Heidi. Really, the collapsed lung is exactly what sent Heidi into Bristol, and you know, we almost lost at that time. But needless to say, it's. I don't want to say it was a good that we had that experience, because you don't really ever want to say that. But at the same time, it's very clear from what Louise has told me that without the knowledge of what we know in terms of what to look for, that maybe this might have not even been spotted otherwise. So, or at least not at this early stage. And, you know, although it's too early to say, hopefully it's a case that the fact that we've caught it early means it won't be such a damaging thing. Clearly at this juncture, everything else sort of goes out the window, so that's, you know, the fluids I'm guessing is still being measured, but in the meantime, surgery definitely won't be going ahead at this moment, which, you know, I guess is a pain because we really wanted to crack on with it. The most important issue is that Noah's stable, which Louise tells me he's sort of settled now onto the ventilation system. Yeah, not really what we wanted to sort of go up and have to see, lots of wires, but at the same time we just hope it's nothing underlying, and hopefully he'll get better really quickly so that he can have the op that he probably really needs now, to be honest.
So I've left him now to come to bed. He's nice and settled and asleep. Not allowed any cuddles at the moment, just in case that makes his breathing faster and whatnot. So hopefully he'll soon be better so I can have cuddles again. Anyway, I'm going to bed now because I am absolutely shattered. So see you tomorrow. Bye.
This is day 23 of Bifida blog. Good morning. Absolutely freezing. I've dropped Heidi off. It's time to go to work. But it's absolutely freezing and I've got no gloves, so my hands are absolutely freezing. So I've had the call from Louise to say what the issue was last night. Obviously the collapsed lung isn't quite what we were hoping for, and it's familiar territory, so that's exactly what happened with Heidi. Thankfully it looks like it's been caught early enough, and they're doing all the right things hopefully, but we'll see him later. So obviously we're going up later as normal, and I just hope he's okay, obviously. Feel very helpless about the whole situation, but hopefully when we go up there we can maybe have a cuddle. I don't know what the rules are at the moment on it.
I was enjoying cuddles with Mummy. His VIs, which is the ventricles in the brain, have increased, and so has his head circumference. So the neurosurgeons have been informed, and they'll ring back with what they want to do. And say hi, little man. Say hi. You've just had your milk. You can see how he's working a lot harder on his breathing.
So here we go again then. It's about 5 o'clock now, just finishing up tea. Hello. Sorry, Heidi, just finishing up tea. So we're going to be on our way pretty soon up to Bristol. Thankfully today seems like he's gone pretty well, despite the collapsed lung business. He does seem to be okay on the ventilator. Clearly not the situation we'd like him to be in, but he's stable and appears to be okay. No, it's not deteriorating at all. Still got a few things to pack, as you can tell. No sooner have you unloaded the car from the last time you come back that you're packing the car again. It's a bit demoralising when you've done all the ironing to come, you know. I suddenly realise what it's like to have to iron all the time. Sudden revelations. But yeah, I've got a few more things to pack and then we'll be ready to go. Who's there? Oh, who's there? Hello. So Noah's had a bit more time on his back. He's just on his side at the moment, or a little bit tilted on his back as well. So he's just enjoying some milk. He's very settled, which is nice. So this will be my last visit. I'll come back on in a minute and Louise will come back up and see him again. Is that nice? Yeah? You like that? Yeah. Oh, you look lovely. Do you mind if I come in there with you? Yeah? Is there enough room in there for me? Did you know I would?
Hello, sweetheart. Hello, sweetheart. Oh, tired boy. Tired boy.
It's the end of yet another reasonably long day. Obviously we've driven up and I'm quite tired now, to be honest. But it's been lovely to sort of go up and see Noah myself and give him one of his feeds and just make sure he's okay, because he's been giving us a lot of concern. And hopefully over the weekend he'll improve a bit more, so we can maybe get back to thinking about whether that surgery needs doing. I don't know what they're going to do in terms of whether they can operate in the condition he's in, or whether he needs to come down a bit before that all happens. Again, something I'm going to have to ask at a later point when I get to catch up with a nurse or a doctor, hopefully on maybe like a round tomorrow, though I don't suppose there'll be any major rounds because it's the weekend, as always. The weekend ahead, we haven't got anything planned. I don't suppose there will ever be a lot planned now, given the situation. We're going to have to do some shopping, so we'll maybe throw something fun in there as well. And there's a possibility of my mum and dad coming up to see us on the Sunday, which will be the first time, it sounds awful, to be the first time I've seen my mum and dad properly since Noah was born, just because we've been so busy. Obviously talked to them and whatnot, but this will be the first time I've seen them. Louise has seen them a week ago, but I've not had a chance to see him yet, so that'd be really great if I get a chance to see him on Sunday. Anyhow, before we do all that, I'm going to have to get some rest, so thanks again for tuning in, and we will see you in the next episode.